Hi everyone, welcome to our Spotlight on NHS Apprenticeships webinar today. Just like to welcome you all, but before we begin, I just want to cover some of the housekeeping bits. So the session today is being recorded and it will be available on demand on the HMY Careers Hub website, and details of that are on the screen there. To help with the smooth running of the session as well, we have disabled delegates' videos and microphones. If you can just make sure that they remain off during the session. If you do have any questions during the session, please pop them in the chat box and our colleagues on the call will either answer them in the chat as we go on, or they will we'll do a Q&A session at the end of the webinar. So that's it for the housekeeping bit. So if I can just introduce myself, my name is Tina Jenkinson and I work for the Humber and North Yorkshire Health and Care Partnership as the Careers and Employability Manager. So the Humber and North Yorkshire Health and Care Partnership formed in 2022 and it comprises of NHS organisations, local councils, health and care providers and voluntary community and social enterprise organisation. The partnership is one of 42 integrated care systems which cover England to meet the health and care needs across a geographical area and coordinate the services and plan in a way that improves population health and reduces health inequalities between different groups. So in Humber and North Yorkshire, we cover a geographical area of more than 1,500 square miles and serve a population of 1.7 million people, all with different health and care needs. So our geographical areas include Hull, East Yorkshire, York, North Yorkshire, North Lincolnshire and North East Lincolnshire. So in order for us to meet the health and care needs of our population, we need to ensure that we have an appropriately skilled workforce reflective of the communities we serve. And this is where my role comes in as Careers and Employability Manager. So my role is to develop our talent pipeline and inspire and grow our future workforce. And one of the ways that I do this is by delivering these Spotlight On webinars, just to showcase the range of careers available in the sector and highlight the variety of routes there are into the sector. So I'm delighted to bring in you this webinar today to shine a spotlight on NHS apprenticeships, which are a real vital talent pipeline to enable us to grow our workforce. So in today's session, we're going to have an introduction to NHS apprenticeships, and then we're going to hear from some of our apprentices about their career pathways into the role. So onto NHS apprenticeships. So what do you need to know about NHS apprenticeships? So many NHS employers will pay you more than the minimum wage. If you're aged 16 to 18 or 19 plus in your first year of an apprenticeship, the minimum you should receive is £5.28 an hour, which is the national minimum wage for apprentices, and that is probably likely to go up in April this year. And apprenticeships take between 1 and 5 years to complete. Anyone over the age of 16 can do an apprenticeship, and there isn't an upper age cap on that. Over a week, you're likely to spend the equivalent of 4 days on a work placement and 1 day at a training centre or college. You'll develop your skills, including English and maths, and you'll gain a competence qualification based on what you can do in the workplace, and a knowledge qualification or qualification combining both. So apprenticeship levels then. So there are a variety of different apprenticeship levels, starting at level 2, which is equivalent to GCSEs. We have level 3 opportunities, which are equivalent to A levels. Level 4s and 5s are equivalent to a foundation degree or above, and level 6 and 7 are equivalent to a full bachelor's or master's degree. So what are the entry requirements? So for entry requirements will depend on the employer and the type and level of apprenticeship that you're applying for. But for example, you may need 4 or 5 GCSEs at grade 9 to 4 or A to C or equivalent to do a level 3 apprenticeship. To start a level 5 or 6 apprenticeship, you're likely to need A levels equivalent to a level 3 qualification or sufficient experience. So the different types of apprenticeships. So we have senior therapy support workers, we have associate ambulance practitioners, business administrators, dental nursing, informatics, HR consultants, healthcare science assistants, maternity support workers, nurse associates, registered nursing degree apprenticeships, operating department practitioner degree apprenticeships, pharmacy service apprenticeships, and podiatry degree apprenticeships. So hopefully from that long list there, you start to get a flavour for the amount of apprenticeships in various different career areas that we can offer. So applying for an NHS apprenticeship, there has never been a better time to start your NHS apprenticeship, but there's a lot of competition for a place. So this means that your application and interview are crucial. So some of the things that you need to think about are you need to show that you're committed, make sure you're aware of your responsibilities, demonstrate that you're able to cope with your work and study, and take a look at the range of apprenticeship career routes on the website. You can find apprenticeship vacancies on the NHS jobs website. So what happens after you've finished an apprenticeship? So you may be offered a permanent job. Most successful apprentices stay in employment, often with the same employer. And it's always a good idea to check whether you'll be offered a job at the end of your programme. Or you could continue your studies through to an apprenticeship at a higher level, or you may have the qualifications you need to go on to university. So hopefully that's just given you a very brief overview of apprenticeships within the NHS. And I think what's probably going to be more interesting to those of you on the call today is to actually hear from some of our apprentices to find out a little bit about themselves, how they got into their apprenticeship and what a typical day in their life looks like for them. So I'd now like to hand over to Harley, who is going to talk you through her career journey. So over to you, Harley.
Thank you. So my name's Harley. I work at York and Scarborough Teaching Hospitals. The apprenticeship that I'm currently undertaking is the Level 3 Data Technician apprenticeship. But I actually do work within the apprenticeship team for the trust, so it is the perfect department to be undertaking an apprenticeship. So here's my sort of pathway from leaving school. It's quite random. I did go a bit all over. So obviously I left school in 2010. No career aspirations at all. I didn't know what I wanted to do. My options in like year 9 were anything that you enjoyed. That's how I'd worked it really. So I left school with some GCSEs. They were okay, probably not the best I could do, but they were okay. And I knew that because I didn't have a career aspiration, the good idea would be to go to college. So between 2010 and 2013, I went to college. My first course that I undertook was motor vehicles. So I decided that I thought it was hands-on and that would be a good option for me. I did 1 year of motor vehicles. I thoroughly enjoyed it. It was actually amazing. But I realised that working in a garage maybe wasn't for me, wasn't the route I was going down. So then I enrolled onto travel and tourism. So I did another 2 years of travel and tourism, and I did really enjoy that. Did some work experience in a travel agent, and again really enjoyed that. But it was the time when, say, Thomas Cook were closing and stuff, so I didn't go for a job in that area. So in 2014, I was looking for a role. I'd left college. I was doing a bit of part-time work, and I noticed a level 2 business administration apprenticeship role come up at the local hospital at Scarborough Hospital. And I knew obviously the NHS is a great place to work. So I thought I'd give it a go. And that's where I started really. That was my NHS starting point. So in 2014, undertook my level 2 business administrator apprenticeship. That was just over a year long. And then in 2015, I gained my band 2 role. So I did gain a permanent position, sort of in the job that I'd undertook my apprenticeship. And within that time, when I was my band 2, I was able to undertake a standalone customer service qualification, which was fabulous, which stood me in great stead. So I continued in that role for quite some time, and in 2020 I gained a band 3 position within the same department again. So I've stayed in the training area. So within 2020 2020, I then was given the opportunity to undertake an apprenticeship. So that was when the new apprenticeship standards had come out. So I did the level 3 business administrator apprenticeship, because obviously my role had developed, so I had more scope to be able to undertake that. Then moving on to 2021, a vacancy within the department came available, and that was the band 4. So again, because I've done my level 3, I was able to apply for that and luckily gained the position. And so from there, I've now enrolled onto the data technician apprenticeship. So I've done 3 apprenticeships now over my 10 years of being here, which is fabulous. Still undertaking the data technician at the moment. So next slide, please, Tina. So my role, I couldn't do a specific day because every day is different. No day is the same. So I thought I would just list some main points that I do undertake within my job. Obviously communicating with customers face to face, over the telephone, via email. I'm often in contact with internal customers who are interested in progressing their career, so want to do an apprenticeship, or if they need support whilst on their apprenticeship. I have managers contact me who would be interested in recruiting an apprentice, or again, need some support with their existing apprentice, so maybe with off-the-job training or anything like that. I'm also in contact a lot with external training providers, so to discuss the programmes or to discuss learner progress. I maintain and develop our internal database, so that's obviously where my data technician apprenticeship comes in. So I'm the main person that deals with that. That might be data entry, so updating any new apprentices that come on or anyone who has completed their apprenticeship. I update the database as I go. Alongside that, so that includes, I need to often pull statistics from the database. So sometimes NHS England ask me to pull stats from there. I can find trends for different business planning meetings. If managers need information on their department, I'm able to pull information from the database. And then including in that, it could be I have to produce visualizations for data. So my apprenticeship is fab for that because I'm able to produce graphs, pivot tables, anything like that for managers that need information on specifics really. So next point I've listed there is sourcing training providers. So as I've mentioned, I deal with a lot of training providers to find programs that are right for each person. I may contact them to discuss the training model, delivery model, the cost of the training. So that's the main part of my role really. I'm often in contact with all sorts of providers for all sorts of programs. And then the next point down is offer support to colleagues. As I've mentioned, I'm here to help any colleagues that are on apprenticeships, that want to do apprenticeships, that managers want apprentices in their department. So I'm happy to help wherever possible. It's fab that I get to communicate with so many different people. And then the final point I've popped there is produce promotional literature and support events. So like this one, National Apprenticeship Week, it's a manic week for us, supporting all events. So it's really fab getting out there as well and trying to promote apprenticeships to different people. So that's sort of a bit of an insight into my role.
Thanks very much, Harley. That was great. I think it's a really good overview there and really shows that there's a huge amount to your role as well, and some really great opportunities when working within the NHS to progress, which you've quite clearly done. So thanks very much again for sharing your story. If I can hand over now to Jess Lees, and Jess Lees is the Workforce Project Assistant, and she'll talk through her pathway. So over to you, Jess.
Thank you. Hi everyone, I'm Jess. I work at Humber Teaching NHS Foundation Trust. As Tina said, I'm a workforce projects assistant, and I have been at the trust now for 3.5 years. So I completed my GCSEs in 2018, I knew I wanted to go down the business route, but still wasn't too sure at that point in exact sort of what respect that would be. So I went to Bishop Burton College and undertook a BTEC level 3 admin qualification. Whilst doing this, I did work experience placements within private and public sector businesses, and that's when I developed an interest in HR. I knew sort of it was something I wanted to get into, and I knew I didn't really want to go down the university route because I didn't particularly enjoy full-time studying. I enjoyed being in the workplace. So I was successful in July 2020 during the pandemic to secure a Band 2 HR apprentice role at Humber. This was my first sort of proper job, but it was in extremely strange circumstances given we was in a lockdown, but it definitely got me exposure to a lot of things I don't think I expected to get exposure to. And whilst doing my Band 2 HR apprentice, I was doing a level 3 HR support apprenticeship, and I managed to go around all of our teams within HR to get exposure to all of the different areas. And then I managed to finish my qualification, did my EPA, which was a lot less scary than I expected it to be. And then I became a Band 3 HR administrator. I was in that role for about 6 months, and then this role came up on advert, and I was encouraged to apply. And I managed to successfully interview for this role in October 22. So I now work in the strategic HR team, and I'm about 3/4 of the way through my level 5 HR qualification, which I'm due to finish in September. So similarly to Harley before, I've now done 2 apprenticeships, or near enough 2, with my trust, which is, you know, such a great opportunity. If I can have the next slide, please. So again, my days does not look the same. So I went through what I thought was my main kind of things I do in my role over the year. So we have the staff benefits. So in my role, I'm responsible for maintaining the staff benefits we offer as a trust. We recently got funding last year to create a benefits website for the trust, which can be viewed internally and externally. So that took quite a lot of work last year, getting everything sorted with that. The national staff survey and the pulse surveys. Anyone that works at the NHS knows how important these are. So I'm sort of work with my colleagues to make sure that everything goes to plan, and work with comms on promoting the surveys and collecting the data once we've got the results and distributing this across the trust, and creating the actions. Policy and toolkit work. So I work on ensuring policies are updated as necessary, and we also now work up toolkits to accompany our policies to support our managers, and work with our TCNC union representatives to ensure that they're happy with the policies that we're producing as well. Managers newsletter. So this is something that goes out bi-monthly, and I'm responsible for collating the information. It's just an easy way for us in HR to get out important messages to managers that might otherwise be missed. And we work this up on a system called Canva, which is something that's free to public sector businesses, which we've find very beneficial in creating our sort of creative documents, which I would highly recommend to anybody to use because it's very easy. My apprenticeship off the job hours obviously take up at least a day a week of my working week. So I spend most of my time shadowing because I find that's the most beneficial off the job training for me. I don't find reading and things like that to stick in my head, so I much prefer the hands-on element. But also writing assignments takes quite a lot of time, so it's about factoring that into my working week as well. Job evaluation, admin, and panel member. So I'm job evaluation trained, and I am the lead on the admin for the trust. We implemented a new system in 2022, which I took the lead on, which makes the process a lot smoother. ad hoc projects within Workforce and OD. So, for example, some of the recent ones, we've got the Carers Project. We work up different guides for the directorate, and we're doing some self-assessment panels within our directorate at the minute, which we've been assisting on. We have our intranet pages. So we created a tracker when I started in my role, because we realised we had over 100 pages, which we're not getting kept on top of. So this is now up to my team to make sure it's up to date and useful as it can be for all of our staff. The Humber High Potential scheme. So this is a scheme that runs yearly. So you have a cohort a year, and I was successful in getting on last year's cohort. So this is something where 1 day a month I get dedicated time to do this. So I got access to an executive mentor. I did a Luminous Spark profile, which was sort of like a self-reflection type thing. Lots of training and development within this. And it's helped develop my confidence, which is why I enrolled onto the scheme. And then finally, Senior Leadership Forum admin. So we have a forum for all of our Band 8As and above, and I sort out the admin for this with my colleague each month to make sure it runs smoothly. But I could probably talk about my role all day, but we've got plenty of other people here to share their roles. So yeah, thank you.
That's great. Thank you very much for sharing that, Jess. I think again it just shows the opportunities that are available working for an organisation like the NHS, and those development opportunities. There really is that potential to be able to progress your career and go on to those higher level apprenticeships. So that's great. Thanks very much for sharing your story with us. So I'm going to hand over to another Jess now. So I'm going to hand over to Jess Smith, and she's going to talk through her career journey.
Hi, so I am the Digital Communications Apprentice at Hull University Teaching Hospitals, and I finished school in 2022 with the below GCSEs, English Literature and Language, Maths, Sociology, Chemistry, Biology and Physics, and Religious Studies. And this wasn't my first apprenticeship. My first apprenticeship was actually with a local estate agents, and I was studying customer communications at level 3. Sorry, I didn't put that in there. But in March, I decided to stop it because it wasn't for me, and it was good that I kind of had the experience, but it just wasn't something that I was interested in. My parents have always worked in a trust, and originally I wanted to become a nurse. And so you can see that picture of me on the left-hand side. 12 years old, I dressed up in my parents' scrubs. It's a really embarrassing memory. But I just wanted to share on there of how passionate I am of the NHS and how much I wanted to be a part of it. So in May 2023, I got the role of the Digital Communications Apprentice. And I actually found the job through MedShed, which is something that our organisation, I think a few other organisations partake in doing, and it was really helpful to find what kind of career option I wanted to go with. Could you move on to the next slide, please? Thank you. So my role is really, it widens. It's a bit of everything. My main role is basically managing our very busy inbox, which is where I'm able to troubleshoot staff problems, problems with our intranet, Patty, problems with our website, and basically just being a helping hand, really. I've put down there that I've done a lot of troubleshooting. I've helped with the setup of our annual staff awards, the Golden Hearts, and similar to, I think it was Jess, I also help with the staff benefits on our intranet. So that was quite cool to see that someone else did that as well. So I helped organise the staff benefits fair in terms of reaching out to local businesses and just seeing whether they'd like to come and attend, etc. I'm also a minute taker as well. I quite frequently take notes for our LGBTQ plus staff network. And in July 2023, I was really fortunate to able to work alongside many organisations such as CHCP, Humber, Trust, Mind, etc. And I was able to, sorry, I'm really struggling. I was able to work with a engagement store. Sorry, I'm so bad at communicating right now.
You're doing a great job. You're doing a great job.
I work in
Jess.
comms and I can't communicate.
You're doing a fantastic job. Keep going.
And on the right hand side, there is a picture of me set up with my store. So yeah, thank you. So I just wrote some advice for people who are interested in apprenticeships. So never be afraid to ask questions, even if you think you're silly. This morning I asked what a standing desk was because I thought it meant that you physically stand on a desk. Speak up if something doesn't feel right to you. If something isn't quite going right, you're not quite sure on the workload, speak up about it. Ask to take part in projects that interest you. So for example, I took part in the whole Pride and also the Golden Hearts setting up because I was really interested in that. Be confident in your work, take frequent breaks, and network with as many people as you can. And I mean that, just try and get to know everybody and get a really good feel for the organisation that you choose to work with.
That's great. Thank you so much, Jess. You did a really great job there. And I think it's really interesting to hear from somebody who is just at the start of their career. And you can see that potential and where you're going to go. So I'm really pleased that you're enjoying your time as an apprentice. I'm really grateful that you've joined us today to share your story with everyone. So thanks very much. Next up, we're going to hear from Aaron, and Aaron is our digital support technician apprentice. So over to you, Aaron.
Yeah. So I work in the H247 team, and the wider education team at Hull University Teaching Hospitals, along with Anne and Claire. I started 2018, did my GCSEs at Watford, sixth form college. I also wasn't really super sure what I wanted to do. I knew I wanted to do something in IT. So that was one of my main GCSEs that I'd done, was computer science at Watford. And then in 2020, I started my A-levels. Sorry, 2018, I started them. In 2020, I finished them. Again, it was another IT qualification there that I'd done with a couple of others, because I knew that's what I wanted to go into, but I wasn't sure which part. In 2020, I did one apprenticeship at a marketing agency, a local marketing agency called Drunk Animal Creative Studio. This was doing digital marketing apprenticeship, so I was doing web design and development there, and other digital marketing things like bit of photography, video, things. It was an all around creative studio. So it was a full service agency. So I did websites, banners, posters, whatever you needed, adverts, everything. We all got in and did a little bit of it together. I left there just due to there was fortunately no role at the end of it. And so I left from there and went to work at a Tesco warehouse near us, in Goole. That was just as a interim job, just to fill some time. And then in 2022, I found the apprenticeship for digital support technician at Hull. That started in February 2022. And I started working within the education team of H247, and learning the system from scratch. It's not a system that really exists outside of, well, sort of does, but not as H247 outside of Huff. So I'd had no idea what it was, so I had to learn it completely from the start. But then in 2023, I have been taken on a full-time contract about August or September time, 2023. So I am off the apprenticeship now and on a full-time contract within the H247 team. Yeah. Do you mind going to the next slide, Tina, if that's all right? Yeah, so my daily tasks are giving support for Hey247. So Hey247 it's the Trust e-learning platform. So it has everything on there from e-learning to booking face-to-face courses, online courses, anything like that. But also it holds things such as like your appraisal data for the trust, and there's a few other things that it does as well. So yeah, mainly giving support for it through face-to-face support if people do come in. A lot of support on the phone, but mostly we've got a shared inbox between the team that we all dip into. My main job really that I do is assisting getting the new starters set up on Hey247. So that's anybody new that joins the trust needs a Hey247 login. So it's going through checking for new starters on ESR and then getting them set up. I help as well with the education team just to give customer service for that as well. We are part of the education team, but there's I think Claire will be maybe able to explain it a little bit. There's 4 teams within education, and Hey247 is just one of them. But then there's also like a main admin team that looks after all the courses and stuff. So we've been in the same place. It's a case of just answering the phones for education as well as Hey247. And helping more recently with the simulation team. So that's doing more training for doctors with simulation courses, so using different mannequins, and it's different types of courses. To go on, I want to just develop my knowledge of the IT systems and more of Hey247. I'm nowhere near, I don't know, probably not much of Hey247 really compared to the amount that it can do. I think we are actually getting a new system, so that'll be fun. And then continue to support with the career ambassador team. I think Jess also helps out with that. So that's things again with Anne and Claire, such as open days to go into schools and colleges in the region, to I guess a little bit like this really, but face to face, just to say what we do and why it's a good career. So yeah.
That's great. Thanks very much, Aaron. That's really great to hear your story as well, and a really different career as well. It sounds like you get to do lots of different things within your role, and great that you're an ambassador wanting to go out there and inspire our future workforce. So that's great. Thank you very much. I think so far, I think hopefully we've tried to give you all an example really of the different types of apprenticeships within the NHS that aren't patient facing. Not all careers working in the NHS involve patient contact. So we just wanted to give you that overview to show you that there is a lot of opportunities. Next, we're going to go on and hear from a guy, Matt Galbraith. Matt is a speech and language therapy associate practitioner. So we're going to hear a little bit more around like the clinical side of the roles. So Matt's not able to join us today, but he has pre-recorded his presentation. So I will play his video. It is around 15 minutes long, but I think you will find it very interesting. And then after Matt, we'll go on and hear from Anne and Natalie to look at the nursing apprenticeship pathways as well. So we'll get that full flavour of lots of different careers before we progress on to a Q&A session. So I will start Matt's presentation now.
Hi there, I'm Matt Galbraith and I'm a speech and language therapy associate practitioner currently working at the Humber Centre for Forensic Psychiatry. It's a medium secure inpatient unit and our wards are learning disability, mental illness and personality disorder. I work in the therapy team alongside occupational therapists, our education lead and my speech language therapy line manager who's an advanced speech language therapist and sensory integration practitioner. I'll move on to the next slide. So first I'll talk about my career timeline. So I finished school 2005. Had an idea of what I wanted to do. It was physiotherapy, but I didn't really have much of a clear idea how to achieve that. Didn't know that I needed to go to college or university. I had no idea about A levels. Come from a very working class family background. We're labourers, joiners, anybody in construction, and then the armed forces. Didn't really have much in way of like support from my family, my immediate family, to look at doing something like this or anything academic. It was just about get a job, get some money, and get food on the table. So between leaving school in 2007, it was just work, different types of work. I think I probably had about 20 different types of jobs. Like nothing really stuck. I got bored quite easily. Still something that happens, but fortunately within this role, I'm on my toes all the time, always learning, and there's always something new to do. 2007, I applied to Leeds Metropolitan University. I was already in the first year of electronic media degree. It was something that I had an interest in, graphic design and art. So this sort of naturally was the next step. I went because my girlfriend went student support to study law, and I managed to get in as a mature student. So that was the 3 years of my life across at uni. In the last year, we had our first child together. So that meant I came back to Beverley, my hometown, and went back into chefing, hospitality there. And that was my career really for, like 10, 11 years. Quite successful in the role that I had. And lockdown happened. Now, just before lockdown, my partner, she qualified as a general nurse, and again, because I have an interest in anatomy and physiology, although I don't really like doing that part of the apprenticeship because it's quite in depth. It is rewarding though. Let me tell you, it is very rewarding. So I like toyed with the idea of becoming a general nurse. So that I was looking at doing my driving and then applying to university. By this time, we had a family of 3, so it was going to be a big ask. But at any rate, lockdown happened, and that was like a year of my life stuck in furlough. Coming out the end of that, I'd been made redundant, catering jobs. Everybody was fighting to get back into hospitality. So the jobs became very competitive. So it seemed like now was the driving force between my career change. So I looked at trying to get a healthcare assistant job in a general hospital, but unfortunately, because of my career experience, the skills weren't really transferable. I was lucky enough to be offered an interview to become a healthcare assistant on personality disorder ward. Was offered the job and accepted it, and was there for 18 months. During the time, conversations between myself and my manager were had about doing the full nursing degree as an apprenticeship. Because there was other people interested in applying to become a training nursing associate. I was I felt a little bit flat, but I already had a good relationship with the then speech and language therapy assistant, who had told me that my current manager had come back to the service. She was moving on to do her top up to become a speech language therapist, or to do the full time qualification. And she said it'd be an interesting job to apply for. Maybe I should look at it. So I did. Had at the time and still challenges with my eldest daughter, which the role helped me understand her a lot better. So I researched more, became more interested and fascinated with the potential of becoming a speech language therapist, and yeah, applied for the job and was fortunate enough to get the job. And that's where it really started for me. I mean, not the beginning of this journey, but the beginning of my apprenticeship. And yeah, that brings me to here. So now I've got 4 kids, which is quite taxing, along with learning, but there's a huge amount of support that I'm getting from my line manager, from the apprenticeships team, and from the training providers as well. One thing that I will say is me and 3 others, we were on a cohort with a different training provider, and it was unfortunate that we were, for better or worse, sort of removed because of I think it was Ofsted. We'd been put onto a different cohort because our tutor had left, and then we eventually were sat waiting with no course, with no training provider, which was for me a bit tough. But the apprenticeships team were continuously looking for a new training provider for us, always touching base, making contact with us, like a huge amount of support. It was just unfortunate that happened, and we have a new training provider now, and they've been amazing, and there's been continuous support. But I just wanted to pop that in there, just because hiccups can happen, and a big hiccup did happen for us, and the way that the apprenticeship team and the trust and everybody involved in our apprenticeships had managed it, it was absolutely amazing. Really, really, really great. So this is me. I brought this a little bit from some of the work that I do with some of the patients. We create This Is Me books, which helps us sort of, well, it's an informative guide of information that some of the patient groups want to share. It helps new staff get to know the patients. It helps patients with the self-esteem. It's a really nice, wholesome piece of work to do with those who are referred to our service for communication work. So at the minute I'm 37. I have 4 children. I'm currently going through an assessment for ADHD. Got a keen interest in neurodiversity. It makes sense. It makes sense to me. And yeah, my interest is there because it's about me, which I guess that's maybe what it's like for all of us. I like making music. I like listening to music. It regulates me. It's really grounding. I love snowboarding. Used to skateboard when I was a kid, so snowboarding just seemed to be like the next step. And it's fun, and it's cold, and it's lovely. That's not me in the picture. I've not been lucky enough to get abroad yet to go and do it. I love cooking. Obviously, I was a chef for years. Worked my way up to management with a potential of opening a place. Still very, very regulating and grounding for me, and interesting. And I'm really energetic. Again, we'll go back to point 3. So I've waffled on for a lot now. I'm feeling quite comfortable in this presentation. I'm mindful that's another 10 minutes. I don't know how long I'm going to be on this. So here's the important part. This is what my role is. So although I'm an apprentice, I am a speech and language therapy assistant. I'm working to that level. And what I do day to day, week to week, is create communication tools for patients. It's a big thing. It's communication. For any walk of life, like we all communicate with each other. We all need to be communicating. We all need to be able to understand how other people communicate. So creating even simple basic tools really support our patients, and they really support like pathways, progression, and how we interact with other professionals, and how patients socialize with others. It's like every behavior serves a function. It's important that we, as professionals, understand that, and my role allows me to support any patient to communicate effectively using tools to do that. There are some low-level assessments that I'm able to carry out. So we have a Humber Centre initial screening. So under the supervision of my line manager, I've been able to learn how to use this tool to gather information for the speech and language therapist to make interventions. I'm allowed to be a part of the decision-making process in that. I'm allowed to offer ideas and see what I think's relevant and what could be appropriate. It helps within my learning and my training to become a speech and language therapist. But overall, like all of my work, no matter how autonomous it is, has to be agreed by my line manager. And again, so that's providing interventions, and it's not the very low level therapeutic interventions. They're not. I don't touch dysphagia, although I'm allowed to work in an awareness manner. I'm allowed to, again, under the supervision of my immediate line manager, speech and language therapist, I'm allowed to provide things like talking mats therapy, although it's not therapy, but I'm allowed to use talking mats to support self-esteem pieces of work, things around confidence, consent, appropriate relationships, communication. So that links into supporting individuals and delivering one-to-one sessions, which autonomously I do now. At the beginning, I would shadow, and then I was shadowed, and then when the speech language therapist was happy with the level of work that I was going through, that I was completing, it became something that I would do: create a session plan, create a care plan. It would be signed off, and then I would just be free to go and do my work. Supporting individuals with the communication, and being an advocate again within the hospital. That doesn't just fall under the role of a SLT, but it feels like this is one of the main actions for me on a daily basis is really advocating for the patients and what their needs are. And creating and supporting group work. So this is things such as Lego-based building. We have a communication and vocational skills group, which is sort of like an exploratory group, which helps support communication strategies, observe and investigate other areas where a patient may be finding it a challenge, and we talk through that, and we can help refer to other services within Humber Centre, and support reflection, support delivery training. This is just some awareness stuff, and I would support my line manager with this. I don't often, or I think maybe there's been once or twice I've held reflective practice, and that was based on ADHD and my knowledge of ADHD in regards supporting interactions with patients who have ADHD. Sorry, now is the time when my brain starts to find difficulty with word finding. And then writing reports, attending CPAs and MDTs, which is basically feeding back to the patient and the rest of the wider professional team on what work we've been doing, what progress we're seeing, if there is any challenges that the patients are facing, or maybe there's some different work that we maybe feel might need to happen with different professions. So we'll just use that space to link in with that. And again, this is all under the supervision of my line manager. And it looks like that is it.
So that was great to hear there from Matt, and I think just showing a different pathway in, and actually that you might have worked in a different career area, but have lots of transferable skills that we're looking for in the NHS. And Matt's obviously shown that he's been successful in using those transferable skills and progressing into an apprenticeship with the NHS. So next I want to hand over to Anne and Natalie, and they're just going to talk about apprenticeships. Over to you.
Go first, Anne.
So I don't mind doing a quick overview and then hand over to your good self. That'd be okay.
Go on then.
Yep. I'll be very quick. Good afternoon, everybody. I hope you're well. Thank you very much for joining us this afternoon. I'm Anne Burdis. I work at Hull University Teaching Hospitals, along with the amazing Aaron and Jess, who are very grateful for them participating today. But as a trust, we work in partnership with everybody else who's on the call today. So we do a lot of work with Humber, we do a lot of work with York. We have amazing partnership over on the South Bank with our colleagues on NLEG. And I think it's okay to sort of say that collectively as an area, we offer some amazing apprenticeships in the NHS. We're going to talk in a minute about some clinical opportunities we have. But just to sort of give a little bit more of a snapshot, which, you know, Tina has also alluded to here, we have some amazing opportunities you would never even think of. A few years ago, we did an apprenticeship in the bereavement services, so in our mortuary. We do them in our IT side. We do them, I'm trying to think off the top of my head now, obviously in the therapist side, but in areas which you don't necessarily think of as being NHS. So really do keep an eye out for those vacancies as they come along. We're really excited during National Apprenticeship Week because we have more vacancies available than we ever have before. We have over 60 vacancies going live today in apprenticeships. The link is there as on the screen, so please do check that out. And in particular, I'm really excited to say that we have a huge amount of vacancies within our nursing team. So really with that, if I can pass over to you, Natalie, and explain a little bit more about the offers that we've got.
Yeah, hi everyone, I'm Natalie. I'm the Practice Development Matron for Hull University Teaching Hospitals. Just looking at everybody else's sort of journey, I dare really say how long I've been here, but actually I've worked for the NHS Trust for our organisation for over 25 years. So I'm feeling really old now. But I've always had a passion for looking after training the students and looking after them on the wards. So I've done this job now for the last year, just over a year now, and I'm really passionate about the nursing apprenticeships. So my role really is to look after, support and recruit the nursing apprenticeships. And currently we've got over 60 nursing apprentices that I'm supporting, or we are as a team supporting in the trust. And I really just wanted to say how many different areas we support them in. So the clinical areas are really varied and vast and really interesting. So from fracture clinic to eye hospital, frailty units, surgery, orthopedics, neurosurgery. They're just their base wards. And then the most exciting time is alongside that is all the placements that we offer as well. And we offer them in reciprocal placements. So we work really closely with our community partners, as Anne said as well, CHCP, Humber, and all alongside Hull University, if that's the programme, the nursing apprenticeships that apprentices have chosen. So really exciting stuff going on in the trust. I'm really proud of everyone that's currently on the programme. I'm really proud that we can offer these nursing apprenticeships. As Anne said, all our adverts have gone live today to coincide with the apprenticeship week. So we're all really excited and really busy at the trust, and we welcome everybody to come along to our open evening on the 7th this week to have get a little bit more knowledge and information and a Q&A really. That's it really from me. So just if there's any questions.
That's great. Thank you very much, Natalie. Yeah, so that brings a close to our speakers, and it's over to the Q&A session now. So I will just see if I can see if there's anything in the chat that's maybe not been answered. Yeah, we can't see anything in the chat at the moment, but if anybody does have any questions, now's the time to pop that in the chat. I wonder, Anne and Natalie, you've got your open evening this week. Have we got a link to where people can book onto that, and is that something we could pop in the chat?
There's no need for a booking in, is there, Anne? So it's just a drop-in session from 4:30 till 7:30.
6:30.
With 6:30, we have advertised it on social media, Twitter, and on our website. So yeah, just come along and just meet the team. We've got the programme leads from Hull University and from our colleges, Hull College and North Lindsey College. So they're attending as well. So if there is any questions, they're the people, and as a team we'll be able to help.
Brilliant, that's great. Don't think we're getting any questions through, so I think we've stunned everyone with our information. maybe a little bit of information overload there. There was so much. What I'll just do now, hopefully this is going to work. What I've done is I have launched a poll in the chat function. And what I'll just ask people to do is if you could just take a couple of minutes just to answer 7 quick questions. It's just a little tick box, just to get some feedback on today's session, and find out how you found it. That really helps us in designing our future webinars. So I would really appreciate if you could just spare a couple of minutes doing that for me. That would be great. So next, I'll give you a couple of minutes to do that. Okay, so I just want to say thank you so much to all of our guest speakers for their time today and sharing their experiences. We have got more information about careers in health and care on our Careers Hub website, and the details of that are on the screen. We'll also be uploading the recording and the slides from today's session onto the website in the events section, and that will be in the past events section. So if you want to go back and reflect and have a rewatch or want to access the slides, then that information will be on the website for you. So that brings today's session to a close. So I hope that you found the session useful, finding out about NHS apprenticeships, and I hope that you'll join us at future events. So thank you very much, everyone, for joining.